guys, welcome to Gloved Up and Scrubbed In. I'm here today with guest Cari Florez. She is the liaison for the largest women's group, correct?
Yes.
We actually did a mud run together,
Yes.
right? Right. She came to me and thought it would be great for some of the physicians possibly to get on the podcast. We met, had a fantastic conversation, and then Cari reached out and said she wanted to share her personal story. So I'm going to let you go from there. First, tell me a little bit about you and where you're at right now and your position at work, and then your personal journey that I think will be very inspirational for a lot of people, males and females.
Yes. So, well, first I want to thank you. Thank you for letting me use this platform to share my journey and share my experience. So I do hope it helps, your listeners. I am, like you said, a physician liaison for the largest women's care organization here in Florida. I am also a certified health and wellness coach and a certified holistic nutritionist.
Which we need.
Yes.
We need.
Well, I needed it for sure.
Yes.
We'll get into that in a little bit. And I am also a former triathlete, former bodybuilder. And I don't know if I want to say former power lifter because I don't think I've hung up that hat yet. I love powerlifting. It's the one that I think could be sustainable, that I could actually continue doing.
Have you done a cross between, but like a CrossFit? I know F45.
I haven't tried F45.
Okay.
I haven't tried F45. I did do a CrossFit years ago and it was brutal.
Yeah.
But I love it. We met at the mud run. I used to do not only triathlons, I used to do sprint athletic. So it would be like maybe a run, then maybe a kayak, and then maybe a bike.
Not necessarily swimming. They would have 3 types of fitness. Okay.
Yeah. So I did a lot of that. I just always enjoyed being active. So it's been a journey. I remember when I was in high school, my dad before I drove, my dad used to drop me off at the gym and then pick me up 2 hours later. I've always been into fitness.
Do you have brothers or sisters?
I have one older sister.
Okay.
Yeah, so we're 2 siblings. My sister and I are very close. I did convince her to do a powerlifting competition with me about 2 years ago.
That's huge.
Yeah, and it was great. We got to train together, spend that time together. It was actually the Senior Olympics because we're both over 50.
Ah, and you look beautiful.
Thank you.
Beautiful. Yeah.
So that was a great experience. But with all of that, with all that knowledge and all that experience, I still managed to keep a really big secret for 20 years or so. And that's why I'm very happy here today to be able to share my secret that only less than a handful of people actually know about me.
Right.
And it's a secret that I kept for a really long time out of just shame and embarrassment. But I'm at a point in my life, I think, we spoke briefly about this in another conversation. It's like when you're at a certain age, you don't care what people think about you anymore.
No.
So I'm very confident.
You take power back.
Yeah.
You're like, okay, this is who I am and that's it.
And that's where I'm at. And people that understand me and know me, they're going to love me regardless.
Right.
And I'm sharing something that's very vulnerable, and I'm just going to get right into it. Let me just say it, right? So I don't know if the proper terminology is recovering from or a former, but I was bulimic for about 10 years of my life. And nobody knew about it. Not my partner, not my family, not friends.
Can you remember the day that it started?
Yes,
okay.
I do. I remember the day it started. So for me, it was the turning point. So prior to me having my son, I got married. Let me go back a little bit to give you context. I got married at 18 years old.
Young.
Really young.
Yes.
Right out of high school, was pregnant at the age of 20. And then by 21, I was divorced and I had my son. So I had my son who was
it's a lot to go through. And
a lot.
Being young. And then in those short 3 years, the transition, some of the trauma of what you face, and you have this new baby to take care of, right?
Exactly. And that was already scary enough because I never had a child, didn't have a partner to live with me to experience that with because we were already divorced by the time he was born. But I love my son and he was a gift.
Right.
And I think if it wasn't for my son, it probably would have turned a whole different way in a bad way. But that was a turning point. So my mental health was not in a good place. I had postpartum depression. I gained about 15 to 20 pounds that I could not shake off. No matter how much time I went to the gym, I just didn't really know what I was doing.
Your hormones, your body doesn't go back anyways. And being that young, there's nobody there really to tell you, or even back in that day to say, hey, it can take a year or two for your body to go back to what it was, or sometimes it may not.
Right.
And that's okay. So you're now stuck and you're feeling like you don't have control.
Right.
Right? You have this weight on you.
Mm.
Did you feel less attractive? Did you feel out of control? Like, what was it?
Yes, all of that.
Yeah.
Very insecure. It didn't help that the divorce was not a friendly divorce.
Yeah.
So there was a lot of, you have stretch marks. No guy's going to look at you now. And it was a lot of putting me down.
Defamation. Yeah.
Yeah. And
talking down to you and belittling you.
yeah. So that of course didn't help. And I do want to say my son's father is a great person, and we were going through a tough time. Me and him are great friends today. So, I didn't say any nice things to him either at the time.
She's like, oh, I'm going to say, okay.
So it wasn't because of him.
Right.
But it added to my insecurity. It added to the way I felt about my body. I did not feel comfortable in my body at all. In anything that I wore. I just felt horrible.
It's hard.
It was. And it was a lot to go through because I was still very young. I had a young son. I was still going to school. So I remember I was going to school for radiology, and I remember being in class and my scrubs were just soaked with breast milk. And it was just, it was just such an awkward time in my life, and I didn't know how to handle it.
Let me tell you, the 20s are hard. People think, oh, they're the best years. No, you're a mess. You're leaving your home that was this security, and you're going out and you're trying to find your own footing. You don't have money to really support yourself. Your body's going through changes because you're turning into a woman now, opposed to a young girl or a teenager. You're not sure like what career path you're going to take. So all that encompassing. And now you have a son that you're trying to take care of on top of it.
Right.
So, and your body's changing and you're in class, and not how many people had kids at your age. You're sitting there so they can't even
relate.
No. So,
and most of my friends at that time were, they weren't married yet, they didn't have kids yet. They were doing other things. They were in college, enjoying the college life, doing what normal kids that age do. And as I learned more about bulimia, I know now that it's very common between the age, teenage years and the young adulthood. So it's very common in that time frame where I experienced it. Right. And that was when it started. So I remember the day, going back to your question, I remember the day that it happened because I was in one of those terrible state of minds where just didn't feel good about myself. I had just had a enormous meal, ate more than I should have. And then I just had a thought to myself, like, well, why don't I just throw it up? I ate, I feel so full. I feel so disgusted. I feel disgusted myself with my body. I'm just going to go throw it up. And it was very easy for me to throw it up. It didn't, some people, it's hard. People can't make themselves throw up. Right. For me, it was so easy. And then like a light bulb turned on and I'm like, oh, this is my solution. And it became once a week. Then it became, twice a week, then every other day. And my go-to was to binge and purge. And I felt so much better after I purged. It was like this relief. And I thought, honestly, the ignorance and not knowing, I was uneducated. And I thought I wasn't doing myself any harm.
Nobody noticed it. So no family members, no friends. Would you get up and go to the bathroom, excuse yourself?
So what's really funny is that's why I said the partner at the time never noticed that every time we would eat, I would go to the bathroom.
Right.
Like immediately.
Well, I have to pee a lot. So and my husband like makes a joke sometimes. He'll be like, all right, before we leave, are you going to make it home? Do you want to go to the bathroom? I'll be like, what the heck? I'm not too. But I'm like, yeah, I'll be right back. So I think men, they just, okay, a woman has to go to the bathroom alone. She's just going to go. So I can see how he could have missed that. A girlfriend or a mom, another woman, they might have a little bit more of an intuition of what's going on.
I did have a situation where a coworker called me out.
Really?
So I was at work. We had just had lunch and, I did my routine, went to the bathroom, had just purged. And this coworker, God bless her, she was a recovering drug addict, and she worked at a rehab that dealt with people going through, drug addiction, but also eating disorders. So
she knew right off the bat. Yeah.
So
she was in tune.
Yeah. So I come out of the bathroom and she's standing there waiting, and she looks at me and she's like, "Are you okay?" And I'm like, because I was not about to admit it. I was her boss, of course. So I was like, oh no, she can't know. Like, this is embarrassing. She's not going to respect me. And I was like, yeah, I'm fine. Why? And she was like, and she just had this look at me like I could say, she was like, I know what you're doing, and I said, I'm fine. Why? She was like, whenever you want to talk about it, you know that I'm here.
Oh, that's awesome.
Yeah. But I never
opened the door.
But I never went through it. I couldn't. I wasn't ready.
Right. And that's the key right there. You weren't ready.
I wasn't ready. So that was about the only person that called me out. But other than that, no one.
If you're not ready, because I worked for Tampa General Psychiatric Center for 3.5 years with acute high risk females, boot camp boys, and I would have the anorexic bulimic. They would have the NG in their note because they were so bad. Like they just weren't even eating anymore. We would have to do one-on-ones. Cari, I would stand while she was brushing her teeth. I would have to stand right here with her and watch her brush her teeth because they would get so good at vomiting just by a little bit, just touching that and brushing their teeth and vomit. So if you're standing back there, you wouldn't even see it.
Wow.
It would get to that point. It was that bad. Like they were ready to die. She wasn't ready. So I commend you for doing the hard work and for actually having, because it's painful to figure out why you're doing this, to admit to it, especially to come on a social media platform like this.
Right.
Because nobody knows and you're better, and it's, why are you going to share and air this?
Right.
You know? And I think, and I don't want to quote you, but I just know that you feel empowered now and you're comfortable in yourself and you want to help somebody else. And you're like, listen, look at me. I'm up here. I'm doing great things, but I didn't come from that. That's not what, let me tell you my story.
Right.
So it's so impactful. So.
No, and I agree. And I think when you're going through it, so in my 20s, when I was going through it, I did not see a light at the end of the tunnel, right? I didn't see hope or me getting better. I thought this was going to be it. This is what I'm going to do for the rest of my life. And the funny thing is, it didn't help my weight at all.
No, it doesn't. It maintains your weight.
Yeah. It didn't make me look the way I wanted to look. It didn't affect it anyway, but psychologically, I thought I was doing something.
Sure.
So it was a crazy thing. And I have to say that it was very shameful. I go to the doctor and they always ask you, and I see it more now too. They either ask you or they give you a questionnaire for mental health, right? Are you feeling depressed? Are you feeling sad? And there's just something about that it just it didn't feel right. It didn't feel like where I would want to share.
Right.
You know,
and it's impersonal.
Yeah.
So they hand them out, you know, the nurse's aide or whoever's coming around, or just your packet of papers and you're going through and you're like, what am I going to, no, I'm fine. It's somebody wasn't taking the time with you. Or really looking at you. They were looking through you. It was just quick, right? So I understand.
So the turning point from doing that almost daily, and then the thing with the purging part is that it does affect your throat, right? So there would be times I would be, coughing up blood.
Esophageal bleeds. You would get the bleeds, yes.
So I would get that. So what would I do is I would give my throat a break and I would use laxatives, or I would go to the gym. I mean, I remember my son, even at a really young age, telling me like, gosh, you're always at the gym. So I would compensate. So if I couldn't throw up, I couldn't purge, I would do other behaviors.
Would you do some type of cardio for hours?
Oh, yes. And that's, again, not really knowing about exercise and nutrition, what I know now, thinking that was the answer too.
Sure.
And there were so many people around me that I could have asked for help. If I knew then what I know now, I would have handled it differently, right? I would have came to recover probably much quicker.
You had that light bulb to throw up, right? To purge. What was the light bulb where I have to stop? Okay. Like enough is enough.
Oh, yes. So my dentist, who's still my dentist till this day because of this. So I went to my dentist and I had been going for him for years. So he saw the progression of my teeth, right? He wasn't a new dentist to me. And he basically said, are you throwing up? And of course, I was still in denial.
Right.
And I was like,
well, no, because if somebody confronts you, like, did you take that last cookie?
Yeah.
You're like, no, I didn't take that last cookie. Yeah, I didn't.
So I looked at him straight in the face and like I was offended. I was like, no, what do you mean? And he looked at me and it was almost the same look that my coworker gave me, or he said, he looked at me, had a silence. There was like this little awkward silence. Like he was waiting for me to say something else.
Right.
But when I was like, no, I was adamantly saying no. He said, okay. He said, well, if you were throwing up, you're risking the loss of your teeth. So the acid in your stomach is eroding your gums and you could lose your teeth. And he was like, but that's only if you were. If you're not, then that's fine.
I love how he presented that.
Yeah.
That's fantastic because he gave you the information of what could happen.
Right.
So he was fulfilling his role, right, as a healthcare provider, saying, I want to make sure you know the cons of this.
Right.
but he wasn't looking at you and saying, okay, you're doing this. Right.
I didn't feel judgment. I didn't feel like he was looking down on me.
Right.
I really felt like he was just trying to say, listen, hey, you're really affecting your health. And
how old were you?
By then I was probably in my late 20s.
Okay. So 7-8 years later?
Yeah. So I've been doing it for a while.
Okay. I want to ask, I just know, from dealing with patients for so many years that have had eating disorders and such. And I understand the control with not eating, like holding it back, the anorexia, not feeling like they deserve to eat, that kind of, then they can develop the bulimia. So they'll go back and forth. There's the bulimia just by itself. And then with the laxatives and such, when you're taking the laxatives, it's because before you go for colonoscopy or whatever, it's going to clean you out. Is that the same thing, what you felt? Did it work immediately? Like, I'm trying to understand the psychological part of it.
Right.
And what it did to your body too.
Yeah. So for me, it was just, it felt like a release. Like I wanted to get the food out of my body. So it was just a way of.
You felt like it was bad.
Right.
Okay.
I felt like this food wasn't doing wasn't doing me any good. It was harming me. I felt more disgusted. I just keep remembering just feeling disgust. And that's how I felt.
Do you know what you associated with it? Was it something somebody said to you directly, or was it just your own control because you didn't have control over everything going on at the time?
Well, I think it was a combination of everything. So prior to me having a child, I never thought about what I put in my mouth.
Yeah.
I never thought about exercising to the extent that I did. Like it was never.
It was more fun. You were just going and doing. Right?
Exactly. I never felt self-conscious.
Right.
I wore bikinis. I would wear anything. It was never a thought.
Right.
But then after I had my son, I overthought about everything. I felt terrible about myself. And I probably took words that people said to heart when I shouldn't have.
Created like a body dysmorphia.
Oh, for sure.
Yeah.
I definitely had body dysmorphia. And I probably took everything personal.
Sure.
Everything but probably somebody could have given me a compliment and I would have taken it in a negative way.
So did you go through therapy? Like, how did you?
So no. So I wished I would have, right? Like I said, if I knew then what I know now, I definitely would have sought professional help. And I didn't. And that's part of being just ignorant, not knowing what was available, not knowing what I could do, to seek professional help. But no, honestly, it took a lot of time and a lot of effort. But after I got that news from the dentist, I made a decision and I said to myself, I have to change. Like I have to change.
Scared.
I just pictured myself gumming. Like
then you're
right?
like, hold on a second. I'm doing this. I'm going to have no teeth. No.
Right.
Did you ever get back to the weight you wanted to get back to?
No, not during
the bulimia. Okay, no. That's what I wanted to know. No. So that did not solve any of the problems. No. And people need to know that if you are vomiting, you're not going to get back to the skinny person. It's just doing what you said. It's getting rid of or cutting yourself or hurting yourself. You're hurting yourself.
It was a release.
Yes.
I don't know how else to explain it. It felt like a big, okay, I did. It was a release.
Right.
And no, it didn't. I could not knock off those 15 to 20 pounds. It wouldn't go nowhere.
So you decide you're going to try and stop. Did you do like a cold turkey? Did you?
No.
Okay.
So it was progressive. So it did take time. But I started off by starting educating myself, right? I learned about food. I started learning about, nutrition, and I started learning about supplements, and I started learning about exercise. So I just started to get more information, right?
Right.
And I learned about metabolism, and I started like, okay, well, I go to the gym all the time, but I'm not doing it right. Right? Like cardio. That's not what I need.
No.
So right. I learned I was going to the gym, but I really wasn't I wasn't getting the results I wanted because I wasn't doing what I needed to do. So I started learning more about that. And I had a great circle of friends at the gym because you know how that is. You go to the gym every day. You have like a gym family.
Right.
And I had a great friend he's still my great friend today, is a coach. He's a bodybuilding coach. And I just said to him, I want to do a show and I want you to be my coach. He looked at me and he said, okay, but I'm going to tell you right now, it takes a lot of dedication, a lot of your time. You're going to have to say no to a lot of social events. You're going to have to say no to a lot of food. It's very restrictive. And if you miss one of our team meetings, you're kicked out the team.
Oh, wow. Okay.
And he said, and we meet every Sunday at such and such time, whatever. And if you can say yes to that, we'll do it. And I agreed, of course. And being restrictive is not a problem for me, right?
Right.
I can restrict myself. It taught me so much. I learned about exercise, right? I learned about lifting weights, and I learned progressive overload, and I learned about mobility, and I learned about all these things that I was like, oh wow, this is how you're supposed to exercise. This is how you get results, and this is how you see a difference in your body. I learned about hydration. I did 2 shows. The second show I did with the second coach because he just had a different way of coaching the team. Where my first coach was great and everything, and he gave you a meal plan, and you had to stick to the meal plan and supplements and all this thing. And I was pretty.
You felt comfortable with the structure.
Yes.
You do well with structure, right?
I did very well with structure, and it was very restrictive. Like I didn't eat a lot.
So portion control now.
Yes.
So now you're learning, okay, I can eat every couple of hours, but there's going to be portion control. Yes. I got to keep my metabolism up. I got to go higher protein.
Yes.
Watch my carbs, so on and so forth.
Yes. I learned all about tracking my macros, proteins, carbs, fats. But what was, I think, very helpful is that I had a team. So I had other men and women doing the same thing. Right. So when I'm like, oh my gosh, I am starving, I would either call one of the teammates or we became friends.
Right.
I had like a support, somebody to go to when I had a question or when I was going through something about food or exercise. I phoned a friend. I think that was really helpful. I didn't feel alone, and it deterred me from wanting to purge. So that,
because you needed to eat, you needed to have enough protein,
yes.
You needed to stay on this schedule, right? There was somebody there that was holding you accountable, and then you were able to kind of regulate everything. Okay, that makes sense. Yes. Excellent.
Which, since you worked with people with eating disorders, the weight, getting on a scale is a scary thing.
Right.
And with this coach, he weighed us every week.
He did.
Yeah.
Which can go the other way, right? Mm-hmm. There's 2 levels there. There's 2 ends of the pendulum. My patients that I see that I do with weight loss, I tell them, I don't want you weighing for like 2 weeks. Stay off. Some of them will try and get on there every day. I go, you can't do that. Mm-hmm. Like, I want you to release that. I want you to let go. I want you to tell me how your clothes fit. I want to know how you just feel inside when you look in the mirror. What does your face look like? That's where instead of getting, because you and I both know muscle is expensive. It weighs a lot more than fat does. So when you start to put that on, you may either not move the scale, but you actually are because you're reducing the body fat, or it's going the other way. You may gain a little bit of weight because you're putting on muscle.
Correct.
Yeah. Mm-hmm. And when you lose muscle from anorexia, bulimia, it's so hard to put back on. So you were doing it in a healthy way, and you were gaining muscle, and you were feeling good, and you had structure.
Yes.
Right. And that's coach number 1.
Yes.
Okay.
And that definitely helped reduce the purging. It helped reduce that behavior.
Right.
Now, going to coach number 2 on my second coach, he was less restrictive. Right. But by this point, I was more comfortable. I was getting a better relationship with food. So I was like, okay, well, he's giving me a little bit more leeway. It was a higher carbs meal plan. The first coach was very low carb. So he was higher carb. He believed in carbs. Like, he only restricted carbs really close to the show. Other than that, during your prep, it was pretty high carb and high protein, but it was less restrictive. And I noticed, so when I did my first show, believe it or not, I didn't like how my body looked. I didn't like it at all. I had definitely lost and gone down to I was smaller than even before I was in high school.
Right. Right.
And I didn't like it.
You liked to have more curves?
Yes, definitely wanted more curves. So with the second show, I did have more curves. I think I had already had a little bit more muscle, so that helped.
Right.
And I just enjoyed the second process a little bit more because it was not as restrictive. And he definitely focused on more strength. So he wanted me to do heavier weight and focus on strength rather than just physique, right? So you can see a lot of bodybuilders that have these great muscles, but they're not very strong.
Right.
Right. So there's a way of training, for strength versus just for building muscle. And he helped me through that. So that second show, I did like how I looked. I felt better. Another thing with the bodybuilding thing, your hormones are all out of whack, right? So I didn't have my period for a while.
Yeah.
Hormones were crazy. My emotions were crazy. It's a process. And then once you come off of the show, when you're done with the show and you're coming off of the prep, you feel horrible. So it was like.
So did you see a lot of eating disorders with people in the bodybuilding field? Because I know what they go through and the medications they inject in themselves or they take or the diuretics, they limit themselves. And I know a lot of them may struggle with some type of eating disorder. Did you see
For sure. For sure.
Okay.
There's definitely a lot of eating disorders. There's definitely body dysmorphia. I didn't meet one. I mean, I'm trying to think of a person that I met in the bodybuilding circle that didn't have body dysmorphia. Because I remember looking at a particular person and being like, wow, you have like the perfect body, the symmetry, the muscle definition, everything. And they saw nothing but flaws. And it just like wowed me.
Mm-hmm.
You know, I said, so, you know, it was very, very common. And different people did different things. You know, like you said, there are definitely medications. And I'll be honest, I did take Anavar, which is a steroid.
Sure.
I took Anavar for both of the shows I was on Anavar. But it was a really low dose. And, you know, it's what most of the women take in bodybuilding. But there is abuse, just with anything. There is abuse of steroids. And I did see a lot of that.
So when you stopped doing your shows, so your 2 shows out, did you now just encompass everything that you learned and continued it? Then that allowed your progression? I'm trying to understand, like, when was the final, like, okay, this is it. Like,
Okay.
I'm done,
Mm-hmm.
right?
Yes.
And
so it definitely helped. During COVID, I got certified as a health and wellness coach and as a holistic nutritionist. So I was at home, like everybody else, stuck at home. And I want to take advantage and I want to dive deep into nutrition and exercise and all that. And I did. And that really was a turning point for me because, of course, I had already, by that point, I wasn't doing it as often. Like I was slowly getting rid of that behavior. But during COVID, when I got educated, really dove deep into nutrition and vitamins and all that kind of stuff, the urge went away because all I kept picturing was the food that I'm putting in my mouth. I kept picturing what it's doing in my body.
Right.
So as soon as I made that correlation,
Yes.
I was like, you know, I'm a sweet tooth, so I love chocolate, right? So I will indulge in chocolate every once in a while. I don't purge anymore, thank goodness. But yeah, so I just kept thinking what I'm putting in my mouth, what it's doing to my cells, what it's doing to my gut, to my skin. Like I just kept correlating the food that I'm taking and what it's doing to my body. And that really changed the dynamic that I had with food, how I thought about food, about eating. And doing the bodybuilding shows helped boost my confidence, right? You're almost half naked in a stage in front of all these people.
Yeah.
Right.
Yeah. You got to have some confidence to do that.
Yeah.
It's one thing to be like in your bathing suit on the beach, but when you have to go up there and you have to pose and you're in front of like a million people and there's music and everything else. So
it definitely helped boost my confidence. It helped my relationship with food. And all along, I did work on my mental health. So one of the things that I have to say, so I'm a health and wellness coach too. And one of the things I tell people that I work with is, and this is a non-negotiable, you have to have a gratitude practice.
Ooh, tell me what that is.
Yeah. So a gratitude practice could be, for me, I enjoy journaling, right? So journaling, I can do a gratitude journal. And it could be something as simple as every single day, I just write down 3 things that I'm grateful for, but you can't repeat them, right? So I can't repeat the same 3 things every single day.
Okay.
So every day
it's like a building block.
Right.
Okay.
Every day you're thinking of something that you're grateful for, 3 things that you're grateful for, and they're different every single day. And I want to say that there are studies that's been done on this, that when you are in a state of mind of gratitude, you can't be sad.
I didn't think about that.
Yeah. So it's one of those things that I learned and I incorporated, and it helped me tremendously. And even till this day, when I feel sad, I don't journal or do the gratitude journaling every single day, but when I'm down and I feel sad, I start a gratitude practice. I worked with a gentleman who was a football coach, and he knew about nutrition. He knew about exercise. He was into the fitness thing and everything, but he started developing a bad habit of coming home from work, sitting on his couch, drinking his whiskey and falling asleep drunk. And it was affecting his marriage. It was affecting everything because he gained weight. He became lazy and he started going down this depression. I said to him, okay, let's just start with something simple. Let's start a gratitude journal. I'm not journaling. I'm not writing down, you know,
Right.
He was like, who journals? Like, well, and I said, okay, all right. I said, okay, walk me through your day. What's your routine? And he walked me through his day. So he told me that one of the things he does every single morning without fail is he gets up, makes his coffee, and he drinks his coffee in the kitchen.
Okay.
And then he begins his day. So I said, okay, when you're making your coffee and you're drinking your coffee in your kitchen, take that time because you're there waiting anyways, right? You're not doing anything else.
Yes. Yeah.
Just think of 3 things that you're grateful for that day. and every day make it different. Just do that. We're going to start there. And I'm just thinking to myself, gosh, this is a very masculine guy that doesn't like
men have a very feminine emotional side to them. All of them. I don't care how masculine they are.
They don't show it, or they don't like to show it.
They don't.
Yeah.
But once you open it, you tap into it. Cari, I've noticed so many men are coming left and right to me now. Head CEOs of, I'm just like, what? And I'm like, okay. They want an opening.
Yes,
so
they do.
So he did it.
He did it. And then I remember, and we did other things, and I worked with him with other things. He ended up stopping drinking, and it helped his relationship with his wife. And I remember him telling me at the end, because I always asked him, what could I have done better for you? What could I have,
something that simple that you changed his life.
And he said the best thing I could have done was that gratitude experience.
That's incredible.
Yeah. So I think that really helped me. And
that's a therapy, guys. That's a fantastic illustration of a cognitive behavioral therapy. And it's that simple. It doesn't cost anything. You don't have to go out of your way and visit somebody. It's you and yourself right there, and it will just overflow to everybody else. Yeah, that's fantastic.
Yeah, and it was definitely life changing. And of course, I did other things, meditation. So I learned to meditate. That's very difficult too.
I'll be sitting there and I'll be like, okay, I got to do this, I got to do that.
Yeah.
Right? To shut down everything going on in my brain. That's a task in itself. How did you get your brain to shut down?
Thank God for YouTube, because I listen to a lot of guided meditation. Yeah. Okay. So Joe Dispenza, I don't know if you're familiar with Joe Dispenza.
No.
Love him. He's a wealth of knowledge.
Somebody talks to you to get you.
Yes.
Okay. Because me, if I'm just sitting there by myself, I'll be.
Yeah, your mind wanders.
What are you doing? I'll call you. Hi, Cari. I tried to meditate for 36 seconds and it didn't work. Now what? You're going to be like,
yeah. Especially if you're a busy person that has a full schedule, you're thinking about the next day. What do you have to do? Do you have to do laundry? So for me, guided meditation helps because I'm listening. Joe Dispenza.
Okay.
Yes.
Okay.
So he talks a lot about the quantum physics, and when you're in a meditative state, you have to think about the future and not the past. So it's envisioning whatever your goal is, right? So if your goal is to be a bodybuilder, envision yourself as a bodybuilder, envision yourself on
fires your brain.
Right.
That's what it's doing too.
Exactly. But it's guided. So the hardest part of meditation is just getting to the meditative state, right? Because once you're there, you're there.
Right.
So the guided meditation helped me get there.
It's almost people that can't sleep either. It's getting them to sleep. So what process do you have to take them through? So that's even a beautiful thing to do, right? Before they go to bed, just to sit there and maybe listen to someone and to meditate.
Yes.
And that will bring it forward. So,
and there's different types of meditation. So there is a meditation to help you sleep. Mm-hmm. There's a meditation for abundance.
And I want that one.
Yeah. Yeah. And he has a great morning meditation. Dispenza talks about in the morning when you're just waking up, but you're not fully awake. Right. There's a name for that, stage of sleep, where whatever you think of actually becomes more embedded in your reality. So whatever you think of in that early morning of your waking up stage really affects your day, your mental health, what you think. So he has a meditation in the morning that you can listen to. I think it's a 30-minute meditation.
That's exciting. Good.
Yeah.
If it's podcasts, if it's the meditation, if there's some type of therapy, exercise, whatever it is, I'm like, teach us, tell me, we learn. Yeah. How did you move forward, and how are you feeling great and you're having this abundance, right? Yeah. So that's great. Okay.
It definitely took time, effort, and grace, right? So there was times that I did relapse, right? There was times that I did overindulge and I did go back to, but the difference was that it didn't feel like a release anymore. I didn't feel good about it anymore.
Right.
And I was like, why did I do that? I was like, that was so stupid. I shouldn't have done that. So it was a change. I started noticing the change of behavior, and I just started noticing I didn't get that
it's like with anybody, right? If they try and stop smoking, vaping, it becomes a habit, first addiction, so, and if you go backwards because you want to have that same feeling, but then you realize, why did I do that? It took me so long to get out of it. I want to move past this. I gotta go forward again. So that's okay, right? You can tell everybody that's okay.
Absolutely.
If you stumble, get back on track. That's the main thing.
Exactly. And that was it. It took time, because it took time for me to educate myself. Mm-hmm. It took time to learn about mental health and how I can help myself mentally.
And now you're helping others.
Yeah.
Yeah, you are, really.
Yeah, no, and that's why I said appreciate you giving me the time to share my story, because I know that there is a young woman out there. It's, statistics say that it's prevalent between teenagers and a young adulthood.
Right.
So I know that that's the age group that we tend to
be hard.
Yeah, and they're hard on themselves too.
Yeah, you're trying to find yourself and your way. Or even if you get into your 30s and you go through a divorce, or you're in your 40s and you lost your job, and now what am I going to do? Male or female. Mm-hmm. Some people drink heavily. Some people indulge in extracurricular activity, drugs, marijuana, cannabis. I see it all coming in my way. And everybody wants a fast fix to stop it, which I can. Mm-hmm. I can give them medications. There's Wellbutrin or Contrave and everything to cut down cravings. Mm-hmm. If it's for alcohol, if it's for smoking cigarettes, it's for overeating. There's the GLP-1s, mm-hmm. Everything that's going on. But if you don't do the homework, the therapy, like you're talking about, you're going to go back. There's also, I wanted to bring up, it's not in the DSM-5 yet. It's called orthorexia. Orthorexia is this fixation on clean eating. So you'll see somebody go to the restaurant, they want the grilled chicken. What kind of oil are you using? I can't have this type of oil. I'm not going to have rice because it's too much carbs. I'm going to have the vegetables, but please make sure that they're steamed. No sauces. I'm going to have the salad, but take the tomatoes out because those cause flare-ups, and the carrots cause this. And so just basically give me lettuce and put the dressing on the side, but I really don't want dressing. So you can become obsessed with that too. And that's another disorder. And you justify it by saying, oh no, it's clean eating. And then they start to look down on you or judge you. Let me tell you, I'm probably at McDonald's or Starbucks getting a frappe 3 times a week. I love them. I don't care. I'm going to go do it because I've gotten to that point in my life where I'm like, this is okay. Everything in modification, as far as what you're eating and drinking, you're okay.
Yeah.
You have to understand that. Mm-hmm. Going back to the orthorexia, for social media and the new hype, it's just all this clean eating, make sure you do, and it's not reality.
No.
Because then you can't socialize. You go to somewhere and it's a pizza party, just limit yourself. Have a slice of pizza. Mm-hmm. It's good. Maybe a salad. And so I do a lot of education with my patients with that, and counseling and support, and then also reconstructing just what their prior thoughts in association to food are and who their support system is. So
let me ask you a question.
Yeah.
So I know this whole thing with the GLP-1, because I'm thinking back, like I wonder if when I was going through this and GLP-1 was effective, I could see myself abusing that.
Okay, let me tell you, it's very abused. So when a patient comes in, there's screening questions, and one of them is their height and weight. But if it's on a telehealth platform, they can lie. Another one is I make sure they don't have any history of thyroid C-cell carcinoma or MEN cancer. It's contraindicated because in rats, it grew. So any other cancer, it's fine. It's just that one. They have any history of pancreatitis. So we go through these screening questions, right? If they're diabetic, so on and so forth. Then I do a set of labs. So I want to know, okay, is there any thyroid issues? I check their kidneys. I check their liver. I check their A1C, because people can exaggerate and say they're a diabetic, or they can lie and say they don't eat a lot of sugar. But that A1C is going to tell me because it's a 3-month. Right? It gives me a 3-month
Numbers
vision.
Don't lie.
Yeah. And then I'll do a lipid panel so I can see their cholesterol and all this other stuff. So what happens is patients will come to me that are underweight, and it used to be you have to be at least a BMI of 27 or greater. Now, you and I wouldn't, if we were 10 pounds, 15 pounds overweight, we're still not going to hit a BMI of 27, right? We're not there. But I understand you don't feel comfortable with the 15 pounds, the 10 pounds on you. Can't get it off. You're going through menopause, right? Your metabolism, your lifestyle changes is basically what it is. You're not as active and so on and so forth. I have no problem with helping you using a GLP-1 to get that off. But then if you go in excess and you keep getting thinner, and keep getting thinner, or you don't deal with it, you're at your goal weight. What happens is if I don't transition them off or elongate it, so instead of taking it every week or microdosing it so it's little itty bitty, and they stay on it every week, they can have adverse effects. There's the Ozempic face. It's where they lose all the fat in their face.
Yes,
and it's
I've
very
seen
gone.
that.
Their hair becomes very, very, very brittle because they're now developing like a pernicious anemia. So they're not absorbing. So because what it does, the GLP-1 slows down the gastric emptying of your stomach. And makes you feel more full. It helps with food noise. So it would shut it off. So you wouldn't even think about food, right? You wouldn't feel as hungry. But if you take a little bit too much, it makes you nauseous and makes you throw up. So
That's
a
that
person,
line.
yes, a person that's feeling bad about themselves or they want to punish themselves, instead of going by my guided dose, they'll increase their dose just so they feel that sickness. And then they feel like, okay, they're punishing themselves. So I see some of that statistics, maybe like a 1%, but it's enough for me to want to get and educate people out there and to learn everything can be abused. All these medications, everything can be abused. So understanding, okay, how do we use this and utilize it? Because it's done beautiful things. It's done beautiful things.
Well, outside of weight loss, it has anti-inflammatory benefits.
So great.
Right?
Every inflammation, PCOS, with your liver function, your lipids, your cholesterol, your diabetes. I mean, health related, it brings down the primary and secondary cardiovascular events. So all the statistical analysis that's come along with that, it's a fantastic medication. But again, under the supervision of a licensed provider. You need to be. A lot of people go to these spas and they'll get it for cheap. They don't check it for endotoxins. So you don't know what the heck you're injecting.
Right.
There could be bacterial particles in there and you won't notice it until week 4 because it's building up, right? And reproducing. They don't have a certificate of analysis. It's a fantastic platform for losing weight, for inflammation, bringing down even arthritis, feeling, mood for PCOS, and also reversing PCOS. And like I said, menopause, and just men overall with them. And if they drink a little bit too much, that's another thing. If you smoke or drink, it turns off the receptors.
Yeah, I've heard it has anti-addictive. People it could reverse addictive behavior.
It does.
Right.
It totally does. And they will, if you have 1 or 2 alcoholic drinks when you're used to having 6 or 8, you'll be hammered. You'll feel it and you'll have a bad hangover. Because remember, it's slowing the gastric emptying. Right. And so it's staying in your body and building. It's not and it intensifies whatever it is. Sweets that you normally would want to just sit there and eat, you'll have a bite of it and you'll be like, I don't want it.
Right.
Pizza, you'll have a whole pie. You'll maybe have a slice. So it allows your brain to rest and not have that as a priority that you're focusing on so you can move on with your life. I have a lot of patients say, I always think about my next meal, or if I ate too much, for breakfast, I got to do 2 hours of cardio later on, Right.
Right.
And with the GLP-1s, they don't think like that anymore. It's like gone. It's beautiful. So yes, I prescribe it. I love it. I was trained under Eli Lilly Pharmaceuticals. I was their national provider speaker for Trulicity, which was one of the first GLP-1s. And then I was on the board for Mounjaro. So I'm very confident and comfortable, and I've treated thousands of patients. So any information or anybody that wants to come for consultation or just even us talking here, ask away, because I'll give you answers and I'll give you statistics and everything like that. Again, picture yourself when you were 20 up to now. It might have been your go-to.
Right.
Because it would have.
Yeah.
If you give yourself too much, you will be nauseous all day. Next day, you might vomit, and then it takes it away. But then you can stay on it for longevity. It's fine because it's for diabetics. That's why it was originally made. But you also have to, when you get to your goal weight, think, okay,
now what?
Right. What do I need to do to sustain this? And like how you did, you had structure. You had a group of people to talk to and to reach out to. So it's very, very, very important.
It is. Modern medicine just amazes me every single day. And we can't rely on medicine for everything, right? So the support system, like you said, doing, your mental health exercise or your mental health routine is important.
Right.
And
you can take that anywhere.
Yes.
So when you travel, for example, like the GLP-1s, they're supposed to be refrigerated. So if you're traveling or you're going away on a trip, I don't know, when you're going to Africa, you're not going to have refrigerator, but you've learned, you know how to meditate, you know how to work out, you know how to eat right, you know your behavior. So I think that's the go-to. That's like my goal here. I'm so glad that you came and you gave your overall like life transition and now your experience, because it's a wealth of knowledge for these patients and for myself, just to learn.
Yeah, no, I'm appreciative of the time, because now, so I've been bulimic free for 8+ years now.
So I'm so proud.
Thank you. I'm proud of myself.
Yes,
too.
you should. You should put your shoulders back.
Yes, I'm proud of myself.
Yes, you should.
Because it was a journey, and it was a time that I was just very ashamed, very embarrassed. But now I'm very confident. I love my body, stretch marks and everything.
Right.
I don't, I used to think about, oh my, I'm going to get surgery. I'm going to do that. There's just been such a shift in the way that I think. I accepted who I am. Mm-hmm. And it's so
attractive. It is. It makes people gravitate towards you too.
Yeah, I'm attracted to myself. And that's
the most important. Right?
And that's what I struggled with all my life. Yes. I can actually say that and believe it though. You know?
Right.
So it's been a great journey. It really has. And I hope it does help anyone who's listening that's going through something like this, that they know that, they're not alone, and that you don't need to be ashamed, that you should talk to a professional or talk to a close friend, share what you're going through, and just your time and effort. Put time and effort into what you want, and you will achieve it, and give yourself grace. You have to give yourself grace, because you will mess up.
So I just had Lillian Ingram on, and she is the owner and founder of Learning to Achieve Wellness. She has 11 clinics. So they're psych mental health clinics, and she has licensed social worker, therapist, cognitive behavioral therapist, everything there. That if you guys can go back and look on my prior podcast, you'll see everything, and I'll put the information up there if you need help. And I'll put up a 1-800 number, for anything that correlates with it, if it's for depression or anything that you feel that you need help today now. So that's great. There's some statistics that you talked about, pulling up my note.
Yeah, so I know the statistics off the top of my head.
Okay.
So 1.5% of American women in the U.S. suffer from bulimia.
Okay.
That's just bulimia, not anorexia. That's so 1.5% of women in the U.S. suffer from bulimia. We know that eating disorders is the second highest rate of mortality in a mental health scenario outside of opioid addiction. So that, I was floored when I learned that, and I learned that recently. So it definitely is detrimental to your health, and it is something that a lot of people experience. So, and we already spoke about the age group, that the teenage and young adulthood age group that it's affecting.
Right.
So, yeah.
I love food.
Me too.
I do. I'm a foodie now. So it's just, okay, this is who we are. You and I, let's go for lunch.
Yeah,
yeah,
exactly.
Guys, thanks for joining us at Gloved Up and Scrubbed In. Cari, thank you for coming today.
Thank you.
And I will put up that information for you. Thank you.
Thank
Have a great day. Bye.
It felt really natural.
Right?